You need to have one of those baby goats in the office, like the real ones.
No, I've got a real goat. We have a real goat here.
Like for real, you do.
For real.
All right, we're going to get into that.
I believe it. All right, here we go. Let's just do it.
Without supplies, there's no surgery. Without products, there's no patient care. Welcome to Power Supply, the healthcare supply chain podcast focused on helping you navigate the intricacies of logistics, purchasing, contracting, and supplier relationships. Each episode, we speak with healthcare executives, supply chain leaders, and innovative entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the loading dock to strategic sourcing, from buyers to the C-suite, and across the enterprise, we tackle the real-life issues impacting the healthcare supply chain. Whether you're tuning in for conversation or inspiration, we're glad you're here. You're just in time to hear it from the source and stock up on insight. So sit back and plug into Power Supply.
On this episode of Power Supply, we will speak with Bill Hale, co-founder and CEO at FetchGoat. And just when you hear the name, you're kind of wondering, what is FetchGoat? Well, it's really at the core. We're going to get the story today, but it's at the core of new optimization opportunities in courier services. Technology is taking this to a whole new level in terms of management. And, Bill and his team are leading the way, and they're going to tell us all about what the savings opportunity is and help us understand why this is within grasp now, where maybe it hadn't been in the past.
You better stand by because you're going to learn about Geronimo, you're going to meet Piper, and you're going to learn a whole bunch about this whole automation piece of courier services. So stick around.
All right, Bill Hale, he's the GOAT, and he's up next. Stay with us after a short break.
I'm Hayes Walder.
This is Gary Skinner.
And I'm Justin Poulin.
From the studios of Healthcare HQ, you're listening to Power Supply.
Joining us now is Bill Hale, co-founder and CEO at FetchGoat, and the name might be attracting your attention right away, so we're going to get into all of that. But really, this is about courier management and what opportunities exist today to improve this category of purchase service. So, Bill, thanks so much for coming on the show.
Yeah, thanks for having me. It's an honor to be here.
Bill, why don't you just talk a little bit about your background? I mean, at some point, I know we're not here to do a vendor spotlight on your company, but we've got to know how you came up with the name. We'd just be remiss if we didn't do that. But why don't you talk about your background in courier services before we even kind of get in too deep here?
Okay, great. So I've been in this business for about 30 years. So I've been a delivery provider, a courier for healthcare, for laboratories. I've done everything from moving specimens to organs for transplant. And, while doing that, we saw a lot of gaps, where healthcare providers could improve services, reduce costs, and which led us to build FetchGoat, a technology company. But I've been doing this for a long time, for 30 years.
You started young, I can tell.
Yeah. Oh, yeah. Yeah. Started when I was 8.
Yeah, exactly.
So let's get the name. Let's get the story behind the name.
We gotta know.
This is the fun part.
Okay. So first of all, I had a couple of roles. I'm kind of a marketing nerd, terrible at it, but I'm a marketing nerd. And so when we come up with a name, I wanted to name to describe what we do, right? And then at the same time, I want it to be spelled correctly because there's a lot of companies out there that they create a name or create a word, and then you can't find them, right? And then the third thing, which was a bonus, was if we could mix in a mascot, I think that would be pretty cool from a marketing standpoint. And so we were throwing all kinds of names out there, and we came up with some ridiculous names. And then finally someone said, hey, what about Fetch? Because that's what the technology does. It goes and fetches information for healthcare companies and then brings it back and displays the form all grouped together. And it's like, okay, great, Fetch works. Well, Fetch was already taken. So we thought, hey, what about Go Fetch? And so GoFetch was already taken. And so someone said, hey, what about FetchGo? And so FetchGo was available at the time, but it was like $16,000.
Oh, come on.
At the time, we were about $16,000 short. So we had spent everything we had in building the product, right? We didn't even have a name yet. So we were throwing that out. I was like, okay, well, that's not going to work. So someone blurted up, hey, what about FetchGoat? We could be like
Go to fetching.
Right, exactly. And so we thought about it. Thought, you know what? That actually works. It gives us a mascot. It's spelled correctly. And then somebody looked it up real quick online and said, hey, we can buy it for $9.95
a year. Yeah, exactly.
That's it. And so that's how we come up with the name. And I guess the byproduct of that is when you Google FetchGoat, it's only us. There's nothing else. It's only us. So it works from an SEO standpoint too.
Bill, can you share a couple of names if you remember some of the other things that you thought about?
Oh gosh, no. Some of them are just ridiculous. So it was all really around grabbing information, and we tried to mix healthcare into it, and we were having such a hard time. We wanted to be a lab care critical was one of them. We were trying to tie the work that we do with labs, but we didn't want to leave the pharmacies out or leave general supply chain out, and so it was just all over the road. So FetchGoat works.
I think it works well, and hat tip to you because it is very catchy.
Thank you.
Let's talk about courier services and why it's so difficult to manage, because you came up with a really cool name and, you're making it sound really attractive. But I got to say, I think there are a lot of people out there working in supply chain that really see this as a very difficult category to manage and get their hands around, especially when it comes to spend.
It is. So, and I look at it from a healthcare perspective. It's the hidden backbone of healthcare. It really is, because you have the healthcare ecosystem, and what connects it all together is transportation, right? I mean, that's what happens. You have a specimen that needs to go for testing. How does it get there? It's got to be transported somehow. And so people forget about it. And the one takeaway that I had personally in working with the healthcare systems was that these aren't just logistics specialists or logistics folks that are managing this. These are technicians. These are laboratory technicians and pharmacy technicians that have a job to do, and they also have to manage couriers, right? And so to me, it was like, goodness sakes, if we could give them some tools to help make that part easier for them so they could really focus on the important part, which is patient care, then we've done a good job of that. So that's how we ended up there.
The bridge is basically, to me, the techs who are paid X number of dollars doing work that they shouldn't. It's below their license, right? I mean,
yeah, that's the key, is that these technicians are the highest paid logistics professionals in the country. I mean, these folks are saving lives, and then also they're dispatching couriers.
So what about the budget for it? I mean, so you're talking about the highest paid logistics folks. What's the budget look like? Like, is this congruent?
Oh, the spend is amazing, because remember, you have so many, it's so fragmented. So what we find typically when we go into a large IDN is you have a mix of contract couriers, you have a mix of in-house couriers also. You have 4 or 5 in-house couriers per location, and then you have some outsourced courier work that you do as well. And so all of that is all fragmented. And so they're all using a different system. And so there's no way to aggregate all that on their own without a technology like that we do. And so that cost is really largely unmanaged. All they look at is that dollar per stop, or that route cost for that courier, or is the daily cost maybe for the courier if it's an in-house provider. But they don't have any visibility to it, and they don't have any way to benchmark that against other areas as well. And so with a system, with a platform, you're able to digitize all of that into one place. Now you can run analytics against it and start looking at past performance, future performance, what we can do to drive savings, for example, which is in excess of about 26% of the spend today. And so Yeah, it's there's big dollars to be saved. It's kind of the last frontier, if you will, for savings.
You mentioned having multiple different providers. And I'm wondering, like, have health systems tried to consolidate to one provider in the past? And what's usually the hurdle for actually accomplishing that?
Yeah, that's a great question. So usually what happens is when they do that, they want to move to a provider that can provide technology for them, right? So they can start to gather some type of data. But in doing so, the challenge is they have these couriers that they've used for years, maybe a mom and pop courier, or maybe somebody that was a semi-retired former employee that become a courier for them. And those couriers, they know every clinic, they know every physician, they know all of the doctors, all the stops, exactly what to do at every stop, where everything's located. So there's a lot of tribal knowledge that goes on with this. And then if you remove that and replace that with some new courier that has technology, you've got to reteach it all over again. And so they end up making mistakes and no one's ever happy. And so, with a solution like ours, that you can continue to do exactly what you're doing today, as long as it's working right. If it's working right for you, we're going to come in and digitize all of that information and then give you the data to help you make those decisions.
One of the nuances that you're describing is obviously there's multiple different vendors. There's no centralized hub for understanding it. They probably don't even bill in exactly the same ways. And so getting standardization to the data to do that benchmarking and evaluation. But there's a lot of other nuances too. And you and I talked about, quite a few of them before we ever, came on to the show. We had a chance to connect. But I think one of those is inpatient and outpatient settings. What are some of the nuances to that? And are they billed differently, or is it just that the courier logistics is so different because, there's a lot more mileage going on from one location to another, just kind of adding up?
Yeah, it is. So typically what we see is that you have the in-house providers, but you're servicing, a couple of dozen clinics or maybe even more than that, depending on the IDN. Those are the contract couriers that are typically managed. And so that's where the disconnect happens, is when you have the contract couriers that they're not able to provide data back. And so there's so many different nuances, like you mentioned, with level of service as well. And so we were just in a situation where we had one of our providers that they had so many stats per day. And the number was like 4,000 stats that they had per day. And a stat, everybody knows what a stat is on this show. For those that don't, a stat is something that can't go on a traditional route, that it has to go, there's a special delivery. Maybe it fell outside the pickup time, but then you have to deploy a driver to go pick up that one specimen and bring that back to the lab. And so this company runs about 4,000 of those a day. And so what we found was that there's a large portion of them that they just had a stat every day. They thought, okay, well, this is how we're going to ship. And so they would call and say, hey, we have a stat today. Well, if we go back and look at the data, they had a stat, every day at the same time for the last several months. And so we're like, okay, so you're paying the highest price for delivery for a stat. You could be paying a much smaller price, a routed price for that same specimen. And so, but it takes data to get us there. Yeah. And so we did that, and we cut that stat spend in half. It was amazing.
Bill, that's kind of like when someone does, FedEx overnight priority when ground would have been perfect.
Right.
Yeah. I mean,
exactly. We asked those same questions. Is okay, if you do FedEx first overnight, when do you actually get into the package? Is it if it arrives at 8 a.m., are you in it at 8:01? Is it that important? Or do you not crack it up until noon?
I would suspect in some cases it's noon. My question I'm trying to get around is there a ratio of what you would expect dollar amount IDN would spend a year? Is there a ratio from 200 beds to how many sites they have? Is there any way to put a number on that? I mean, You might not have it. If so, that's cool. I was just curious.
We don't, because it's literally haze all over the road.
Yeah, I figured so. Okay, we can cut all that out. I was just trying to get a
Well, no, and
picture.
I think that's a good question, Hayes. And is the reason it's all over the road is because of what you just described? Like some places, if the savings opportunity is so huge and the places that do a better job with it are able to control that and the places that struggle more. And I'm assuming the larger you are, the more you struggle to manage it because it becomes vastly more complex. Is that part of the equation?
That is a big part of the equation. It is. It's a big part of the equation because the larger the organization is, the more contract providers they're going to have. The more contract providers are going to have, the more that each of those providers are going to provide different data back to them. And so what you look for is you want to be able to capture all of that data in a single location, so that way you have a single source of truth.
Mm-hmm.
Yeah, I was going to say, in a large organization like that, if you had that scenario you're just describing with the stat at the same time of day, every single day for however many months, that doesn't mean that even if you try to engage your supplier for courier services, that they would see that on their record, because you might have used 10 different couriers throughout that period of time for the same stat request. Is that also true?
100% true. Absolutely true. And it could be a different courier company too, right? Like you mentioned, it could be, we have 7 courier companies that we use in this area, and each of those courier companies has picked up that stat at some point in time. So that won't jump out in their data, right? It takes the aggregated data in order to make that decision. And another one, if I can throw it out there, is what we call unproductive stops or dry runs or zero specimen runs. Happens every single day. And that is that, you could have a clinic closed, like maybe this week. There's a good example, right? We're right on the back end of Labor Day. And so maybe that physician said, hey, you know what? Let's go ahead and close the summer up and close the clinic for this week and give everybody off. Well, then your contract courier is going to stop there today, 0 specimens. Tomorrow, 0 specimens. Thursday, Friday, same thing. And so looking at that doesn't seem like a big deal, but if you're paying that courier by the stop, so let's say $20, $20 for the stop, then that's unnecessary expense. You take that across your entire network. That's a big number.
Big number. And, Bill, one thing that just kind of dawned on me is the complexity of how many people can pull the trigger and ask for a courier, need a request one. We're talking maybe hundreds upon hundreds.
Yeah. Yes.
So
absolutely.
Within an IDN system. So therefore, to your point, if someone's requesting or if it's already on a route, the complexity would be in the hundreds of thousands of trips and or weekly, if not daily, I guess.
Oh yeah. Yeah. No, we see in one large lab in particular, we do about 265,000 stops a day.
A day. Okay, that's a number.
Yeah.
Yes.
Crazy.
You are the GOAT. You know what I'm saying? You can do
Let me ask you too. You were talking about how they're the highest paid logistics experts in the industry. How much time are we talking about them spending on it, right? Like, put that into context too. Like, how much is being taken away from patient care in this scenario?
A great deal, because not only, if you think about it, there has to be a call, right? You have to call the specimen in, and then you're probably going to get an ETA back. So there's probably 3 or 4 calls that are made. Then you have the preparation of the product itself. And then once the courier comes, you gotta sign for it. And, you have to deliver the paperwork. You got to sign for the shipment. There's just unnecessary work that's done on behalf of the technician when it could all be automated and just push a button.
Sounds like a pretty good idea for a product. You know what I'm saying?
It does.
Well, I mean, the best innovations come from opportunity, and this is obviously a huge opportunity.
Well,
Did you get a lot of complaints when you were in courier services before starting this
yeah.
company, Bill? Like, what were the common complaints from healthcare systems about courier services in general?
It would shock you to know the amount of specimens that are lost a day. It's an amazing amount, and it's terribly sad because as an adult, as a parent, that be absolutely life changing if you're expecting some kind of positive news about a specimen, or maybe bone marrow or something that you've had to give, and the specimen gets lost because it fell out of the package or fell between the seats of the courier. But it happens thousands of times a day. Thousands.
That's scary to even think about.
Oh yeah, but it happens every day. I mean, we lose. I can't tell you how many times I've gotten a phone call in the middle of the night where I won't name any airlines, but one of the major airlines has lost an organ for transplant. They're like, we have no idea. We have no idea where it is. And so I've been in situations before where they found the organ, but it was going to not make the surgery, and it would fall outside the time. So they finally found it, and then they located Georgia's Finest, and Georgia's Finest gave us a police escort all the way to the hospital, the transplant center where the transplant was done, and made it like within a half hour of it being no longer being able to be used.
That is absolutely
Happens every day.
Oh my.
Yeah. Well, because organs for transplant ride in the belly with luggage and cargo. They used to ride up top, but not anymore. They ride in the belly with cargo.
I don't need to hear this. It's scary. Someone's life is depending on it, and it's lost with Delta somewhere.
Well, the organ thing, yeah, there's so much there with chain of custody and all of that. But let's talk about the courier's perspective now. Like, we definitely talked about the healthcare side. We talked about what kind of feedback you got from healthcare as a courier. But what about the couriers? Do they struggle, like, when they're getting all of these stat orders to be, I mean, I realize that's probably why they're charging extra, but what's their life like on the other side of this coin?
I would say healthcare is probably the most demanding work you can do as a courier for obvious reasons, right? It's the ultimate price. And that price is, you're not dealing with a late shipment, you're dealing with someone's life. And so you're really paying the ultimate price. So you really need to be on your game, which is why it's so important from the healthcare provider standpoint that you have a great relationship with that courier, and you're able to get good data from that courier, so you can make sure and double check and triple check that they are doing what they said they're doing. And so from the position of the courier, though, it's tough because like I mentioned earlier, you maybe have done this work for 10 or 15 years, for this healthcare system, and they're going to toss you to the curb because they need technology. And look, you're just a small shop. You can't afford a system to do that. And so you get thrown to the side, and they bring in a larger provider that can bring technology, but they're not going to know all the ins and outs, right? They're not going to have the tribal knowledge that you have. And so, from that standpoint, we have made a conscious decision internally. We don't charge the couriers anything to be shared on our platform. IDM pays for the services. We don't charge the couriers. And so, because they're always getting beat up. And then remember that you have the way that you communicate with the couriers is all via phone or text. So some of them may have a website you can enter an order in, but we go back to that technician. So we have a lab technician that's calling in a pickup for a courier, and that courier, either they receive it or they don't. Like in the case of the stats that we were talking about, we found that I think it was 18%. It was a large number, like 18% of those stats were missed that day. Because a technician or someone from the clinic called it into the courier, and they had no way to know if the courier received it, if it's going to get picked up, if it made the 2-hour window requirement. They had no way to measure it. And so from that standpoint, being able to digitize that process now you have accountability, which is so important, because if you have that accountability, but if you're able to digitize it, now that technician doesn't have to pick up the phone and wait on hold to call in a pickup to a courier, or get onto a website and enter that information. They can just push a button and it's all done for them.
Well, let me just ask Bill, traditionally, perhaps in most cases in the market, how are the hospitals managing this if they don't have a service? In other words, like, are they trying to do this through email and an Excel spreadsheet, or what? How do they do this?
It would shock you. Yeah. They're doing it manually. And that's what led to us founding the company. Was we would go in and meet with some of the largest labs and healthcare providers in the country, and then we would go into a conference room and meet with the lab director, for example, or the pharmacy director. And then once we were done, we would go outside and meet with their team, the operations team. And so the team are the technicians that are doing the work day to day, but they're also the ones that are communicating back with our office. They're the ones sending the emails. They're the ones that are making the phone calls back with our office. And we recognize the names, but they're wearing lab coats, And so they're doing all these things that are manually, and it's just commonplace. So that's why we found the niche, and we knew that what we wanted to build could do nothing but help make them more productive, help make them focus, take that task off of their plate, and so they can focus on patient care.
Is that who owns it? Is the lab directors? Like, they're doing this manually, so they have to, do they manage the contracts? Or I feel like the contracts are supply chain. So,
yep.
Does anybody have total ownership?
Yeah, if they do have supply chain, we'll end up in a contract with procurement, but the lab director typically owns a relationship with the couriers. It's usually the lab director, and then the pharmacy, the director of pharmacy. Then third, a supply chain will come in after we've deployed. So we normally start with the lab, right? Because that's where most of the things happen. And then the pharmacy will catch wind of the technology, and then supply chain will jump in on third.
So you're centralizing the data, but we've had a ton of conversations around AI, and I know we're coming to the end of the interview, but this season has had, if not directly the topic being AI, it's come up in almost every single conversation, and it really is exploding right now. Everybody's got their eyes on it, but what's possible once you centralize the data by applying AI to help improve those efficiencies? And I got to think there's a communication component too, because I think you said a bunch of time with the couriers is just sitting around waiting for them to be ready to pick up.
Right. Yeah. So we introduced AI about 2 years ago. So we have a proprietary AI properly named Geronimo. So Geronimo
Wait, hold on. Is that the goat's name?
No, the goat's name. Her name is Piper.
Okay, right. Piper. All right.
She's real. She's real. She's out in a pen. So we introduced Geronimo a few years back, and so we were wanting to use Geronimo for proactive notification in the event of a delay. So one of the things that we had built early on was we built our own weather repository. And so because there wasn't really anything weather related you could hook into at the time, so we had to build our own. And so, and since we operate in 45 countries, it had to be a global system. And so Geronimo is literally looking at weather globally. And in the event of, I'm in the Dallas-Fort Worth area. And so if we have a weather, which we do often, if we have a tornado warning that comes in or a flood warning that comes in, well, then Geronimo sees that. And as soon as the area where those deliveries or those pickups are going to be impacted, Geronimo will automatically send a message to the providers at those locations and let them know that, hey, due to weather in the area, please expect delays on these particular shipments. So we were using Geronimo to monitor weather, but we could also do the same thing with traffic. If there's, big traffic incident and it's going to create delays, Geronimo can pick it up and deliver that message to them. Geronimo can also be looking at when the previous delivery was on the pharmacy side, and so it's made a delivery, and Hayes is going to be the next delivery that it's going to be making. And so 10 minutes out, Geronimo will send a message, either text or a phone call, to Hayes' home and let them know that your items are going to be delivered at the ETA of this time. Because, as you know, most folks that are receiving that after hospital care, maybe it's the equipment being delivered or maybe it's pharmaceuticals being delivered, but they're probably going to need a little extra time to get to the door. And so we try to give them as much time as possible, but we started using AI to proactively notify for the time of delivery. And the crazy thing is, after we talked to these folks, they had no idea they're talking to AI.
Really? That's great. What a great use case.
Yeah, I know we didn't talk about home health, but I used to be a home health nurse, and it's just such an obvious use case scenario. I'd say even out of just, courier services, I'm thinking about just deploying home health aides and resources in home care because of everything you just said, especially in, areas where there's a great deal of traffic. The last thing an employer wants is their staff to be text messaging or, trying to be distracted to notify the rest of their caseload for the day when, that they've been interrupted by traffic. And, you might even have somebody who's done early and you could automatically deploy that. The whole idea of knowing where people are and leveraging AI to make those kinds of operational adjustments is just significant.
Mm-hmm.
It is. And like you said, this is about freeing up these professionals so they can focus on what's important. And it's not managing couriers.
Yeah.
Exactly.
Well,
exactly.
Listen, Bill, this is a pretty exciting conversation. I mean, we've had a number where there are just categories that traditionally people just stayed away from because they knew that my favorite saying from one of my favorite VPs of supply chain out there is every time we'd get into a business review or look at new opportunities, he'd say, I'm just trying to figure out if the juice is worth the squeeze. Yeah. And, he'd ask a lot of different questions around that, but I feel like this is one of those areas where people kind of said, the juice just isn't worth the squeeze here. We know there's opportunity, but it might just not be worth deploying the limited resources we have at it. But I think a lot of these technological advancements have put a lot of things back on the table that just couldn't be attacked before. Clearly, courier services is one of them, and you're leading the charge. Is that a GOAT reference? If I say lead the charge, I'm not sure, but
we'll take it.
Ram it on down,
There we go. We're getting there.
Justin, let me give you just a quick sample of impact. Is the juice worth the squeeze? We had a large lab, a national lab, that we saw issues of that, not those non-productive stops. So we really dug into those non-productive stops. In 2024, we saved them $10.5 million just by reducing and then eliminating the non-productive stops.
And that's on the supplier side. That's not even on the healthcare side. That's on one of the lab providers. That's amazing.
Yeah, it's there.
Bill, great job today. Great job. And keep up the good work.
Justin, I told you he would be good.
You did.
I told you he was going to be good.
You weren't the only one, though. I had 2 or 3 people put him on our radar. So, Bill,
man.
Great job today. You're definitely making some waves. Thanks for coming on.
Awesome. It's an honor. It really is. It's always an honor to be on. Thank you, guys.
The GOAT right here. The Courier GOAT.
That was Bill Hale, co-founder and CEO at FetchGoat. And Hayes, you sent him my way and said, I think this guy's going to be great on the podcast. And then literally 2 other people sent him my way too, or said, hey, have you talked to Bill yet? So it's just interesting to watch all of this uncharted territory in a very short period of time, be chartable.
Agreed. I mean, courier service is not the sexiest part of healthcare or purchase services, but it's a big number. And being able to automate it, digitize it, review it, it's so impactful to the bottom line. So I thought it was really well done. I think he's onto something for sure.
I also had never been introduced to the idea of non-productive stops. And I think he threw out a stat like 18% of, total courier spend is being billed for non-productive stops. That's outrageous to me, the amount of waste. Like, we're always looking for waste, but that's nearly a fifth of the spend is removable just from schedule optimization. Never mind the whole idea of stack calls and everything else.
And think about how many tens of thousands of just couriers driving around town, burning gas and time to go do that. I mean, it's absolutely being able to put metrics on it and view this. I think it's invaluable.
All right, everybody. That was Bill Hale, co-founder and CEO at FetchGoat. And on behalf of Hayes and myself, thanks for listening to this episode of Power Supply.
Thank you for listening to this week's episode of Power Supply. As a reminder, you can help support us by subscribing on your favorite podcast app or by downloading the smartphone app on your iPhone or Android. Simply search for Power Supply in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@powersupplymedia.net. We look forward to hearing from you.